Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hysteroscopy. Introduction. A hysteroscopy is a procedure that allows doctors to look inside the uterus. It is the best way to diagnose and treat certain conditions that seriously affect women's health. Your doctor may recommend that you have a hysteroscopy. If your doctor recommends a hysteroscopy for you, it is your decision whether to have the procedure or not. This patient education tutorial will help you better understand the benefits and risks of this procedure. Anatomy. The female reproductive organs include vagina, uterus, fallopian tubes, and ovaries. These organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. One function of the ovaries is to produce special hormones called estrogen and progesterone. The other function of the ovaries is ovulation, which is the release of eggs needed for reproduction. The hormones estrogen and progesterone help to regulate ovulation. Estrogen and progesterone also prepare the inner lining of the uterus to proceed with a pregnancy. When the ovaries release an egg, it travels down to the uterus through the fallopian tube where it may be fertilized. If an egg is not fertilized, it is discharged, along with the inner lining of the uterus, to the outside of the body during the menstrual period. The uterus is pear-shaped and about 3 inches long. It has 3 layers. The inner layer is called the endometrium. Once a month, if there are no pregnancies and the ovaries are working correctly, the endometrium and the egg are discharged to the outside of the body. This is called the menstrual period. As menopause approaches, menstrual periods become irregular and eventually stop. Menopause occurs when the ovaries quit producing hormones and releasing eggs. If a woman becomes pregnant, the fetus stays inside the uterus until delivery. The uterus is able to get a lot bigger than its normal size. The middle muscular layer of the uterus creates labor contractions that cause the baby to be born. The lowest part of the uterus is called the cervix. It opens into the vagina, which opens to the outside of the body between the urethra, the urinary bladder opening, and the rectum. The uterus is held in place with ligaments. These ligaments help prevent the uterus from slipping down into the vagina.
The urinary bladder is located in front of the vagina and uterus. The kidneys drain urine into the bladder through 2 tubes called ureters.
The intestines and the rectum are located above and behind the vagina and uterus. Indications. Hysteroscopy is a way to look inside the uterus. Many conditions can require a hysteroscopy. The next section includes a list of some of these conditions. Your doctor will tell you which one applies to you. Some conditions result in heavy menstrual bleeding, which can cause considerable blood loss. Significant cramps and abdominal discomfort may happen with the menstrual cycle. Benign tumors in the muscular layer of the uterus, known as fibroid tumors, can cause excessive bleeding. These tumors can get large, causing cramping, pain, and pressure on nearby organs. Parts of the inner lining of the uterus, or endometrium, may become as big as a marble and dangle inside the uterus. The marble-sized parts are called polyps. Polyps are rarely cancerous, but they can cause abnormal bleeding. Malignant cancer may also involve the uterus lining. Rarely, the uterus is divided on the inside by some tissue. This is called a uterine septum. A uterine septum can cause miscarriage of a baby. It may need to be taken out surgically. Scar tissue can form inside the uterus, which can result in a lot of bleeding, abnormal periods, and inability to get pregnant. An IUD, intrauterine device, is a T-shaped method of birth control that some women use to prevent pregnancies. It is placed inside the uterus by a gynecologist. A thread connected to the IUD sticks out of the cervix into the vagina. If the thread slips into the uterus, a hysteroscopy is necessary to take out the IUD. Adenomyosis is a condition where the endometrium, or inner lining of the uterus, grows inside the middle muscular layer of the uterus. This results in pain, cramping, and abnormal bleeding.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Blood tests can help diagnose some conditions. Ultrasounds of the uterus through the abdomen or through the vagina can also be done to see the inside of the uterus. Hysterosalpingography is an X-ray test where dye is placed in the uterus and X-rays are taken to see the inside of the uterus and fallopian tubes. Only a hysteroscopy allows the gynecologist to look directly inside the uterus and take care of some of the problems found. Procedure. During a hysteroscopy, a scope is inserted inside the uterus. The doctor looks inside the uterus. Hysteroscopies can be done in an office or a hospital. Some of the problems found are taken care of immediately when possible. Hysteroscopy is usually done with local anesthesia. General anesthesia may be used if the surgeon expects to take care of major problems inside the uterus. General anesthesia is when the patient is put to sleep for the operation. With local anesthesia, only the uterus is numbed and the patient remains awake for the procedure. Your gynecologist will discuss the best type of anesthesia for you. The patient is placed in stirrups. The vagina is then cleaned to prevent infections. A speculum is inserted into the vagina to keep it open during the procedure. This is usually not painful, but it could be uncomfortable. It is very important to try to relax and to tell your doctor about any pain or discomfort you feel. The cervix is numbed with local numbing medicine such as lidocaine. It is then dilated or made wider with special instruments. Next, a scope is inserted into the dilated cervix and into the uterus. To make it easier for the doctor to see inside, fluid is pumped through the scope into the uterus. You may feel this water dripping as it exits the vagina. The doctor examines the uterus and the openings of the fallopian tubes. Polyps and abnormal-looking areas can be taken out with special instruments. If a uterine septum is found, it can be divided. Scar tissue can be cleaned up and lost IUDs can be retrieved. If needed, the whole inner lining of the uterus, or endometrium, can be taken out to check for cancer cells. Removing the endometrium can also treat some conditions that cause abnormal bleeding. Depending on how much needs to be done during the hysteroscopy, your doctor may also decide to have another scope inserted into the abdominal cavity. This is usually done under general anesthesia. Patients usually go home the same day of a hysteroscopy. Risks and complications. This procedure is very safe. There are, however, several possible risks and complications. These are very unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. If your doctor uses general anesthesia, the risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery.
Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is extremely important to let your doctors know if any of these symptoms occur. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs.
Some risks are seen in any type of surgery. These include 1. Infection in the reproductive organs or inside the pelvis and abdomen. 2. Bleeding, either during or after the operation, which may require a blood transfusion. Other risks and complications are related specifically to this surgery. These, again, are very rare, however, it is important to know about them. Rarely, structures in the pelvis and abdomen can be injured during the procedure, especially if there is significant scarring from previous surgeries, endometriosis, or pelvic inflammatory disease, PID. The uterus and fallopian tubes can be injured, requiring another operation to fix the injury. In extremely rare situations, the intestines and blood vessels could also be affected, necessitating another operation. It is very rare for the tubes connecting the kidneys to the bladder, as well as the bladder itself, to be injured. However, if this does happen, another operation may be necessary and could result in the loss of a kidney. Similarly, in extremely rare situations, small nerves in the pelvis may be injured, resulting in decreased sensation in the sexual organs. Rarely, this can lead to sexual dysfunction. Complications from fluid or gas used to expand the uterus may occur. These are rare. After the procedure. After the procedure, you will be allowed to recover from the general anesthetic, if it was used. A tube may be placed in your bladder to help empty urine. This tube will be removed before leaving the hospital. Some cramping is expected after a hysteroscopy, as well as some vaginal bleeding. You should call your doctor if bleeding becomes excessive or if discharge becomes foul-smelling. These may be signs of complications. You should not have sexual intercourse or put anything inside the vagina until your doctor says it is okay to. The first menstrual period after a hysteroscopy may not be normal in terms of the amount of blood and how long it lasts. You will need to take short walks to help blood circulate in your legs and prevent blood clots from forming. You should tell your doctor if you develop any of the following: a fever, a foul-smelling vaginal discharge, drainage from the incision, severe leg pain, any other unusual symptoms.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hysteroscopy is a very safe and successful procedure. It often helps doctors diagnose and take care of potentially serious gynecological conditions. As you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.